So like I say, a lot of mental health problems are commoner in females than males, and that is why I am an advocate of women's mental health. I want them to be intentional about their mental health. So if you're a woman, you're watching this, please pay attention to your mental health, because we're at higher risk of coming down with a lot of mental health problems like somatoform disorders. Hello everyone, welcome back to my YouTube channel. I am Dr. Adeola. I'm a mental fitness coach. And if this is your first time of coming across my channel, I welcome you. Please click the subscribe button, turn on your post notifications so you don't miss out on the amazing content that I put out about mental health. So today we're talking about somatoform disorders. Somatoform disorders are a group of psychological disorders. So it is a type of mental health problem basically. It, however, presents as physical symptoms. So the person comes down with a physical symptom like chest pain, abdominal pain, body weakness, headaches, and then they go to see a physical health doctor. Investigations are done, but there's nothing to show that they have a medical condition. It could be confusing, especially because of course you expect that someone that has severe chest pain and goes to see a cardiologist should be able to find the reason why he or she has developed the chest pain, right? But then the cardiologist does a lot of tests, including ECG, echo, and there's nothing to prove that this person has got any medical condition to warrant such pain. It occurs in about 5 to 7% of the general population, commoner in females than male, about 10 to 1, ratio 10 to 1. Surprised, right? So like I say, a lot of mental health problems are commoner in females than males, and that is why I am an advocate of women's mental health. I want them to be intentional about their mental health. So if you're a woman, you're watching this, please pay attention to your mental health, because we're at higher risk of coming down with a lot of mental health problems like somatoform disorders. So here are a few categories of somatoform disorders. One, somatic symptom disorder, when this person has multiple distressing physical symptoms varying from headaches to chest pain to abdominal pains that have been ongoing for a while. The second one is illness anxiety disorder, also known as hypochondria. In this case, the person believes they have a particular disorder, a particular physical illness, very severe illness, just like cancer. They could say they have breast cancer or heart condition that is very severe. That's called illness anxiety disorder. Number 3, conversion disorder. This is a situation where a person presents with weakness or paralysis of any part of their body without any neurological condition. So it's usually associated with psychological stress that happens suddenly, and when examinations are done, there's no evidence to show they've got any neurological problem. Number 4, factitious disorder. In this case, the person feigns symptoms, physical symptoms. So they feign that they've got physical symptoms in order for them to assume sick role or gain attention. It's also called Murchison syndrome. And there's another type, or let me say subtype of this Murchison syndrome called Murchison syndrome by proxy, when a person feigns physical symptoms in another person to gain attention. It usually occurs in a child, for instance, a mother to a child. So the mother feigns physical symptoms in her child, keeps taking the child to the hospital to tell the doctor that the child has a particular physical problem, and when all investigations are done, the child is fine. So yes, that could also happen. Number 5, malingering, which is similar to factitious disorder. So the person feigns symptoms or fabricates medical symptoms, but in this case, there's a particular gain they want from it. In factitious disorder, the person does it without thinking of anything to gain. It just happens, perhaps subconsciously or because they are psychologically distressed. But in malingering, the person is aware of what they are doing. So they intentionally feign medical symptoms so that they can get some gain, or maybe be absent from work, or assume sick role, or do whatever gain they want from being medically sick. Number 6, chronic pain syndrome, which occurs when a person has pain in one or more parts of their body. It could be their back or knee or ankle, and this could be very debilitating. Somatoform disorders can be managed. It usually involves use of psychological interventions as well as medications, especially if there are comorbidities. I hope that I have been able to explain this to you and you understand better now what somatoform disorders are. If you have any questions, do not hesitate to ask me in the comments. Till I see you next time, don't forget to be intentional about your mental health. Bye.